Okay, thank you for joining in today. So this is the second time we ran this webinar on Tuesday, and we're running it again today. Next week we'll be running webinars to do with all the safer inhalation equipment. Just to get us started, we'll go over a couple of technical things about the webinar, and then look at the agenda for the day. We're scheduled till 12, but we have a bit of extra time till 12:30 for discussion. So we're going to try and get through most of the webinar before 12 and leave time for discussion. Last week we ended up using almost the 2 hours. Just a quick heads up, if you have to leave early, you will miss the instructions for getting your certificate, but we will record these webinars and hopefully send the links after the fact. So there's the audio again. If you need to log in, there's the audio. Although you're hearing me already if you're on the phone. Please just mute your computer speakers because that will stop any feedback. When you're on the phone, use *6 to mute, and if you want to talk, you hit *6 to unmute. If you would like to say something, you can either use the chat box over here to talk to folks. The whole room can see it, the chat box here. If you see someone that you would like to have a private chat with, all you need to do is hold your cursor over that person's name, and you'll get a drop-down menu, and you can start a private chat with that person. If you would like to really say something, there's this little icon at the top here, just above my green arrow, and you can raise your hand. So if you click on that and drop it down, you'll see a bunch of different options. You can agree or disagree. You can ask people to speak up or slow down. But we would ask that if you want to say something on the phone, just use that raise your hand function. We'll see that pop up, and then we can get you to unmute your phone. That should just help with the discussion. Towards the end of the webinar, actually, when we get into talking about the specific bits of equipment, we do have some polls. These are anonymous, and on the next page, we'll just practice one of those. As I said, you will get certificates for this webinar. If you'd like those, you'll just email us a request. And we are recording this webinar for future viewing. CC, do you want to add anything? Okay. All right. So who's participating in this webinar? Oh, shut up. So that's CC and myself with the Ontario HIV and Substance Use Training Program. We're funded by the Ministry of Health and Long-Term Care. And we do training all around the province around harm reduction, HIV, and Hep C. We also do some capacity building with organizations around harm reduction. And we also chair the Injection Drug Use Outreach Network, which is people working specifically with injection drug users throughout the province. We also have the OHRDP. Nadia from OHRDP is on the line. She'll be able to chime in as necessary, but also at the end of the webinar, if you have specific questions for OHRDP, there'll be a chance to talk to Nadia there. And in terms of who else is participating, these webinars are intended specifically for injection drug use outreach workers, the hepatitis C support teams from around the province, and many of the nurses working at health units around the province. There'll be a variety of understanding and experience with this. Some of the injection drug use outreach workers, this may be sort of somewhat basic, but maybe a review of information. I think it's useful that we're all working from the same language and have the same consistent knowledge around the province. So that's in part why we're doing these webinars. And you will also, though, we'll have people that are maybe brand new to harm reduction, don't understand anything about this. So there's a variety of understanding and people participating. Let's just get a sense of where everyone is from. So bear with me for a sec while I pull up this poll. And here's a way to practice a poll. So I picked some broad categories here, and if you can, click on the where in the province you are from right now. and then we'll be able to see these results. It's all anonymous, so we can't see how you individually are responding. Oh. I didn't get it. Okay, so we'll let's see where everyone's from. Okay. So we have a variety of people. I'm hoping you can see the results. Are those showing up? Nadia, if you're there, can you unmute your phone for a sec? Or if someone can just chat in the window and let me know. Can you see
I've
those
unmuted.
results?
We could see, and then it's, at least on my screen, it's shadowed. I can see it, but it's not as dark and bold. It looks like it's been shadowed. Now it's good.
Okay, that's because I ended the poll and now I've reopened it.
Okay,
so
now it's perfect. Thank
you.
you.
Can see the results. So we have a variety of people. We had probably double the number of people on the call, the webinar the other day, but we've got people from around the province here. Okay. So the intent of these webinars is to make sure that there's consistent knowledge about the injection drug use equipment that's being distributed through OHRDP all across the province. To gain a better understanding of the best practices as it relates to each of those pieces of equipment. So those were best practice recommendations that were developed in, I think it was 2013, 2014. And we want to, again, ensure that if people are accessing harm reduction supplies around the province, that they're getting that same sort of quality of service and understanding, and also to learn from each other. So there are regional differences. People have questions. As I said, there's a variety of understanding experience on the call, and there's opportunities for us to be sharing information and strategies with each other as well. So this is what we're going to talk about today. We'll have some basic introductory stuff around why people might choose to inject, some of the risks associated with injecting. We'll look at some of the language, alternative language that people may use, and I think that's also important to better understand when clients are talking to us, what are they talking about. Also to see that there's sometimes regional variations in terms of the language that people are using. We'll cover a concept known as drug set and setting, and this is something both Cece and myself find really useful in terms of helping people understand their experience with drugs, both the benefits but also the risks. And it's a way to sort of, I think, start doing maybe risk assessments, thinking about how they may change their use or change where they're using in terms of their safety. We'll talk about ways of reducing some of those risks, and then we're going to get into the specific equipment, each piece of equipment, and talk about the best practices related to those pieces of equipment.
Has joined the conference.
Have a discussion about kits versus individual pieces of equipment and what makes sense in terms of when you're distributing stuff, and we'll leave you with some resources at the end of this. Again, anytime if you need to add something to the chat, if you have a question, please do that. Cece's going to be monitoring the chat box there, and you can also just raise your hand again. Just want to acknowledge these have been a couple of years in development, these webinars, and there were a number of people involved at the initial stages, particularly folks at OHRDP, the Ministry of Health, and then some of our partners around the province in Oshawa, Black Cap here in Toronto that work with African and Caribbean folks, and Regional HIV/AIDS Connection down in London. We also, in all the work that Oh Shut Up does, we try to involve people with lived experience, and we had lots of input in these webinars from people that inject drugs, particularly peers and IDU outreach workers from around the province, and it was important too that we had regional representation. So we had folks from formerly AIDS Thunder Bay, and that is actually should be Elevate NWO, not now. Sorry about that. It's now AIDS Thunder Bay has now changed their name to Elevate Northwestern Ontario. Apologies for the typo there. We had folks from Sudbury, Ottawa, and some folks at two big harm reduction programs, South Riverdale and Queen West here in Toronto. Okay, so first let's look at the routes of administration and talk about why people might be choosing to inject. So there are different, for every type of drug out there really, there are different ways of getting those drugs into the body. So most drugs can be taken in all these ways. There are some that maybe you can't smoke, or some that don't work through injection, but typically most drugs you can use all these different methods. So we have smoking or inhaling, injecting, and there are different ways of injecting depending on the type of substance that you're injecting. You may inject into a vein, you may inject into a muscle, or you may have a subcutaneous, just under the skin type of injection. People can snort their drug. The technical term is insufflation, so up the nose, typically a powder up the nose, and it absorbs across those mucous membranes into your bloodstream. In a similar way, people may stick drugs in body cavities, such as the vaginal cavity or the anus, so that would be sometimes known as hooping, or suppositories. Doctors often prescribe suppositories. Sublingually, you can put things under the tongue, and they can absorb across the mucous membranes there. Transdermal through the skin, so things like fentanyl or nicotine patches, the drug absorbs across the skin and into the bloodstream.
Beth from the WEC
And you can also
has joined the conference.
ingest drugs by swallowing them. We just also note that you can get a placebo effect, so I could give you a Tic Tac and say that you're going to feel really happy in the next couple of hours, and you might do that just based on me programming your brain to think a certain way. Or there's also the contact high, where you're not actually taking any drugs or anything, but you walk into a room full of people behaving a certain way, and you pick up on that vibe, you pick up on the energy in the room. We just mentioned those because they can influence someone's experience when they're using other substances. So when it comes specifically to injection, there are real advantages to injecting, but there are also some concerns, and we're going to go into each of these concerns in more detail. So I won't go through all of these just right now, because we're going to explore those in more detail. But I think it's also important. We often think about the risks when it comes to injecting, but I think it's also important to talk about why people choose to and the advantages they may experience from doing that, and understanding why they might actually choose this. So one of the reasons why someone might choose to inject is actually a very cost-effective way to use your drugs. And if you're trying to get your drugs to last longer or get more bang for your buck, this is one way to do that. You actually get the greatest amount from the smallest, greatest effect from the smallest amount of drug. So there's a number of reasons why. If you're smoking drugs, you actually lose some of that drug as the smoke burns off, so you're just not getting that drug. If you snort things up your nose, some of that drug does not absorb across the mucous membrane, and you may blow it out. So again, you're not necessarily getting it all there. And when you're ingesting drugs or swallowing them, you actually lose some of that drug to what's known as first-pass metabolism. So this is where your digestive system actually breaks down some of that drug before it actually gets into your blood system, and you lose some of it to your digestive system. So when you inject, you bypass all of this stuff, and you put the drug directly into your bloodstream. You don't lose any of it, and therefore you're getting it's a more, at some level, cost-effective way of using your drugs. Another advantage is that it hits you quite quickly. So smoking and injecting are both very quick ways to get drugs into the system. And when you inject them, you can sometimes get a much stronger rush and high from that experience. And some people prefer that. This is an example here for crystal meth, just looking at the different methods of administration. And first you have how quickly those effects are felt. And you'll see, again, smoking and injecting very quick in terms of how quickly the drugs hit you. Snorting takes a few minutes, and swallowing can take up to an hour sometimes or more before you feel it. On the flip side of that, though, is the duration is impacted. And swallowing drugs, actually, you get a longer duration or longer effect than with smoking or injecting. But as I said, with injecting, you get that intensity as it hits you so quickly. So as you go up up these methods here, you get a higher intensity, or sometimes known as a euphoric rush. There are some other reasons why people would choose to inject. So some drugs just work better through injection. Some drugs work better through other methods. So it may depend on the actual drug that you're taking or substance you're putting in your body. With other methods of administration, they have their own concerns. So with smoking, you can damage lips and lungs. There may be concerns with oral health, so you may want to avoid smoking there. If you're snorting drugs, for example, you may have concerns with your nasal cavity or the cartilage in your nose or infections that way. So again, people may choose to use a different way because of that. When you're smoking drugs, they give off a smell. And in settings like prisons or bathhouses, there's a real risk of being detected. People can see the smoke, smell the smoke. So you may choose to use injection as a way of avoiding that. And for people that have been using longer term or more heavily, it may be that you've built up tolerance to snorting drugs and you just don't get that effect anymore, and injecting is going to give you more of that effect. So you may move to injecting after other methods of administration. Again, I feel like I'm moving quite quickly, so please jump in if you need to. So I said it was important to look at the advantages, but let's focus on the risks for a minute here and some of the concerns when it comes to injection drug use. So I think it's probably obvious to most people on the call, but there's concerns around disease transmission, and we're particularly concerned about hepatitis B and C and HIV. And we'll look at some stats in a little bit in terms of how many people who inject drugs are dealing with these issues. It's also important to point out that these viruses, they can be transmitted blood to blood, and it's important to recognize how long those viruses actually can live outside the body. So hepatitis C is actually a very strong, sturdy virus, and it can survive outside of the body for a while. Inside the barrel of a syringe, though, or inside the closed environment of a needle, Hep C has been detected for up to over 2 months. So if that needle's sitting around lying there, there could be live virus within it for up to 2 months. HIV is a weaker virus. It doesn't survive as long outside the body, but it has been detected within used needles for up to 2 to 3 weeks. We often think about these in terms of needles, and we talk about needle exchange, but it's really important to understand that all the other equipment involved with injections can get even microscopic amounts of blood and act as potential routes of transmission. And that's why it's important, I think, today that we'll explore all those other pieces of equipment and get a better understanding of those. A couple of other concerns. When you're piercing and breaking the skin, you are now putting yourself at risk for bacterial and skin infections, abscesses. So this can be caused by bacteria that's on the skin or on the equipment. Some drugs themselves can actually cause damage to the skin. We can have damage to the veins. So if you're constantly accessing the same veins, you can do damage. So in terms of tips here, we often encourage people to rotate veins as often as possible, so you're not always using the same one. Give your brains a break and a chance to heal. You might want to consider leaving one vein that you never inject into, just in case a healthcare provider, for whatever reason, needs to access that or to draw blood. So we'd encourage just to keep one vein as your sort of medical vein. And we will discuss this later, but it's important that you're using the correct needle and correct syringe. So needles come in different shapes and sizes, and it's important to find the right one that's going to work for the drugs that you're injecting and also where in the body that you're injecting. One of the big concerns, I think, with injection drug use is the chance of overdose. And this happens because Once you inject, it's all or nothing. All that drug is in the body, and if you put too much in there or it's too potent, there's nothing you can really do about it. One of the advantages to smoking drugs is that you can just have a little puff, wait a minute, see how you're feeling, and then maybe take a bit more if you need to. If you're fine, you don't need to. But when it comes to injecting, it becomes a lot harder to get the dose right and easier to overdose. It's also important to think about where on the body you're injecting. So the green zones in this picture are recommended in terms of injecting. We would caution in terms of the yellow zones, and the reds are really, we would discourage people from injecting in these areas. The big concern is that in these areas, becomes a lot easier to miss and hit an artery, and then you can bleed out. So again, when you're working with clients, encourage them to think about where they're injecting. And there's a link there. You should be able to click on that link, and it'll take you to CATI. So CATI is the Canadian AIDS Treatment Information Exchange. They're a national organization that do sort of knowledge exchange around HIV and Hep C, and they have a number of good resources. And you can order all sorts of pamphlets, DVDs, posters for your offices. So if you have never been to the CATI website, I encourage you to go there and explore what they have. There are some other concerns too. I think when it comes to injection drug use, this is highly stigmatized, even within drug-using communities and within between drug users. The stigma that people experience when they talk about their injecting experiences is overwhelming. And this really impacts their ability to be open and honest with people, to access services. They may feel a lot of shame and guilt around that. So if we're working with people that are injecting drugs, we have to be very mindful of this in terms of creating safe spaces and having those open and honest conversations with people, and doing a lot of work internally with ourselves in terms of our own attitudes and values about people that are injecting, and trying to set some of that stuff aside so that we can create those safe spaces for people to come in and start having conversations. Another big risk, obviously, is with the police, and this varies around the province in terms of relationships programs have with police, but we still hear of reports, that police finding people with injection drug use equipment on them and then harassing them or stopping them or confiscating that equipment. So that's a real concern. And at some level, there can be an increased chance of addiction, and this in part is because of the way the drugs are working physiologically and the way you're putting them into your body, is that you do create this sort of higher rush and more intense crash as a result. And at some level, this can mean that people are more likely to try and avoid those withdrawal symptoms and keep using. So there can be an increased chance of addiction once you start injecting drugs. Again, I don't want to say that's true of everyone. There are some people that can inject, and it's an occasional thing, and they don't have any sort of serious substance use issues. Okay. Just to contextualize a little bit of this, we'll look at a few statistics in terms of drug use here in Ontario. So these were surveys administered, it's a few years ago now. This is part of some work that Peggy Milson has done in Ontario. It's known as the iTrack report. This was presented to our Injection Drug Use Outreach Network last year. So the data is a little bit older. It may not be reflective of exactly what's going on right now. We know that drug use patterns can change quite quickly, and I think it's important, though, to be sort of aware of what's going on out there and the different trends that are happening. But a few years ago, and I think it would still be somewhat similar, but again, it can also vary from region to region around the province. So it may be that you're in an area where there's a lot more cocaine being used, or maybe a lot more heroin, but this is generally in Ontario, sort of the primary drugs used in the past 6 months. You can see people are using a variety of different drugs. And again, that's important when you're having conversations with people to be thinking about some of the risks associated with specific drugs. Okay. Interesting to look at where people are injecting. and we'll talk a little bit later around the setting and the context in which people are injecting, because that can really impact people's risk factors. But you'll notice lots of different places that people are injecting. But interesting to note that people do inject within the shelter and housing systems. But this one here, a public place, over half have been injecting in a public place. And again, when we're thinking about risk factors or people's access to services, these are some things we want to be keeping in mind. So this was a question around, they asked people, have you shared or used or given equipment to other people? And again, it varies from around the province, but we're seeing there's still a significant number of people taking used needles. So that might be where I'm injecting and Cece's here with me and we're both injecting and I say, can I just use your needle? That's an obvious situation. What I think is maybe not captured here is often there can be inadvertent sharing of needles. So you can think of this when if you've ever been at maybe a house party or you're out with some friends and you're both drinking a drink and you put your drink down and you can't remember which one was which. The same thing can happen when people are injecting drugs. So there can be some inadvertent sharing of needles. This question, though, was looking more specifically at situations where people knowingly took used needles. So there's still a significant number of people that are sharing needles, but what's more concerning is I think the number of people that are actually taking and sharing used other equipment. So we'll be looking at this later, the cookers, the filters, water involved, lots of people sharing other equipment still, and this is some work we need to do in terms of the education that comes there and people's access to the other equipment. Just a quick note, you'll see Ottawa data. This isn't that Ottawa's done an amazing job and everyone's using their own equipment. It's just that there's no data there because of the way the survey was administered. They were partnering with an agency in Quebec, so that data just got removed. Having said that, there are lots of good people doing good work in Ottawa. It's interesting to consider gender differences when we look at people's injecting. So this was a question, again, in the last 6 months, and we found that women were significantly more likely to have borrowed equipment. And I don't know if some people might want to just put in the chat box, if you can think of reasons why. Why do you think women maybe are more likely than men to have borrowed needles or lent needles? Or borrowed any of this other equipment. And if you have some thoughts on that, maybe put them in the chat box.
Or you can raise your hand if you prefer to talk.
Yeah. I see someone's typing there. But I think this is an important consideration if we're trying to think about who are we reaching or who are we not reaching, and barriers to accessing services. What's that say? Women may feel some intimacy with others when sharing. Okay. I think often in a heterosexual context, there can be power dynamics at work that play into this. Right? Someone suggesting that perhaps women are just generally more likely to share personal items. Maybe people have less money, so they end up sharing. And again, money isn't just necessary. I mean, people should be able to access this equipment without having to pay for it, but it may be that you don't have money to get to the needle exchange to do that. Right? Someone else is just typing there. I think one of the things we hear time and time again is that particularly if women have children, they are very concerned about children's aid becoming involved and what happens when I show up to a needle exchange and who's going to know what about me. So that may be another consideration too. Do you want to add anything into that, Cece?
I think just when we talk about stigma, in general, I think the point Nick made about kids is important, but there's also, I think somebody mentioned that there may be power imbalances, definitely for sure. When studies were done with heterosexual relationships, it was often found that women were second on the needle, meaning that men were injecting themselves first and then injecting women later. This is particular for keeping women in potentially abusive relationships, and women may not even know where to access equipment or to access their drugs, so they're left dependent on their partners, so that could be an issue as well. They may be more likely to borrow equipment because they just don't know where to get it.
Okay. We're also interested, the study asked people about their HIV status, but also actually had lab results done in terms of their blood. So throughout Ontario, you do see regional differences in terms of the number of people who inject drugs and their HIV status. So there are regional variations there. But generally, we've done a relatively good job of containing HIV within people that inject drugs. There's always a bit of work to be done, but I think at some level this is a good thing in terms of how low some of these numbers are. We will keep in mind, though, that within Ontario, about a third of people that have HIV do not know they have HIV. So these numbers, though these are lab results, I think it's important to understand that there are a lot of people out there that don't know they have HIV, may not be accessing our services, and the importance of just continuing to have that discussion. We'll look at Hep C numbers in a second. Yes, Chandra there is asking about Hep C. We have those numbers in a second. Just one last thing about HIV. They asked about their time or length of time since their last HIV test. And again, this is an important consideration. Just look at the last column here. You know, half of the people have had an HIV test within the last 6 months. That's pretty good. But there are a number of people here that it's been at least a couple of years, maybe even longer. And that would be concerning if you're actively injecting drugs. So I think it's important, again, to continue the idea of promoting testing and maybe helping people through that process if you can. I said earlier that HIV is a relatively weak virus and Hep C is a much stronger virus, and you see this now reflected in these numbers here. Again, these are percentages, but you can see far greater numbers when it comes to Hep C. In some areas, we've got 1 in 4, 1 in 5 people testing positive for Hep C. 3 out of 4 people maybe testing positive for Hep C in some areas. So again, this speaks to the importance of encouraging Hep C testing, but also the importance that people are not sharing any of this equipment. Okay. So I want to move into some different concepts to consider before we actually start talking about some of the equipment. So let's talk about a few other concepts and some of the language that's being used. So you may hear people talking about shooting up or slamming or banging. These are just other terms for when people are talking about injecting drugs. When it comes to the equipment itself, they may talk about rigs or steel. That's typically referring to the needles that they'd be using. Right? A shooting gallery, people can maybe be injecting on their own, but sometimes they do it in a group. So this may be a group setting in which people are shooting up together. Again, the concerns there are you actually keeping all your own equipment, or are you having any inadvertent sharing? The more people that are around, the greater the chance that you may be sharing equipment. We often hear the word junkie as it refers to people who inject drugs. There's a lot of stigma that comes around with that word. Some people may choose to self-identify as a junkie, but we typically try to discourage the use of that kind of language and talk about people that inject drugs as opposed to junkies. These are people. Very often we talk about handing out clean needles, but the opposite of clean is dirty. And there can be a subtlety to that language. It may not seem like a big deal to us, but if you're someone on the receiving end of that, and how do you internalize that language, and what does it say about you? So we try to use language that's different in terms of rather than clean, we say new or sterile, and rather than dirty, we would typically use something like used. P&P is a term you may hear, party and play. This refers to people that are using drugs and having sex. Lots of people across different demographics combine sex and drugs. This term tends to be associated within the gay community and gay men. They typically talk about P&P, party and play. But again, lots of people, all genders and sexualities, are using drugs and sex together. Sorry, I skipped that slide. So this is the concept I mentioned earlier around drug set and setting, and we find this very useful in terms of helping people understand the experience they're going to have, both positive and negative, and the risks that are associated with that particular behavior. And there are these three interrelating pieces that can change each time and affect that experience. The first thing we often talk about is the drug itself, and whether you're using an upper or a downer or a hallucinogen, what are the physical effects that that drug is actually going to have on you. So you could be the same person sitting in your living room, but one night you're drinking caffeine and one night you're drinking alcohol, and you have a different experience. It's because the drug. You're the same person doing it in the same place, but it's the drug itself is causing a different experience. There are other things that people need to be mindful of in terms of how strong or pure their drugs are. Even the cost of the drugs, that can be a risk factor. Half-life is another important piece. The half-life refers to how long it takes to excrete half of that drug or metabolize half of that drug out of your body. And a real example of this would be the differences between cocaine and crystal meth. Cocaine has a relatively short half-life, maybe a couple of hours, and that's why you see people start, once they start using cocaine, they often either snorting it quite quickly again, or they have to keep injecting to maintain the high. Crystal meth has a much longer half-life, up to 12 hours, so the drug stays active in the system for a lot longer. So if we're thinking about some of the risks associated with injection drug use, if you were to talk to someone that's injecting cocaine versus someone that's injecting crystal meth, there may be increased risk for the person using cocaine because they're likely going to be injecting more often than the person that's using crystal meth. So that's the drug piece of it. The next thing we think about is the person that's actually injecting the drugs. And this has everything to do with their psychological state, their physical size and health. Maybe that you don't need as much drug as your friend because they're just a much bigger person. Right? Why are they actually using it? Financial or housing situation, even tolerance. You may have a much greater tolerance, or this may be that your tolerance has changed because you've been abstinent for a while. And this is something we often encourage people to think about if they've been institutionalized, maybe in hospital or maybe in a prison where they've had a break from their drugs and then they come back out, their tolerance might be a lot lower this time around, and they're going to have to think about that when it comes to using. So again, this also can help explain why two people that take the same drug have completely different experiences, because of all these different things, they're very unique and individualized to the person, and that can affect the experience. And then the last thing we talk about is the setting, or the place and context in which is all happening. So that can include the physical location, but who else is also around you? Are you using with completely unfamiliar people you've just met? Or are you using with people that you trust and will look after you if you have a problem? Also the social and cultural norms. So within those peer groups, are there certain drugs that are more frowned upon or more acceptable to be using? This can influence your experience. I think a prime example of how you can change the setting to reduce risks is the example of the safer injection sites. So we see those in BC. We're hoping that we might start seeing safer injection sites around the rest of the country. But what you're doing there, you're still taking the same people and they're still injecting the same drugs, but you're moving them into a safer setting in which they can do that. So they're not injecting in unsterile environments outside, but they're doing it in a context which is safer. There's people there to help them, and what we've done there is just change the setting, and that's going to influence people's experience and risks. Again, jump in if you have any questions on the chat there, or raise your hand. Hopefully this concept makes sense to you, or hopefully it's a useful tool in terms of when you're starting to have those conversations with people. In terms of, we often get very focused in terms of what the drug is, but we might want to start paying more attention to things about the person itself or the setting as well. I just see a couple people typing there.
While folks are typing, I'll just jump in as well. Often drug use is about the ritual and the practice itself. And the setting can have a big part of that. So when you're working with people, asking them questions, if they're deciding they want to make changes around their drug use, whatever that is, when you ask questions about the setting, who are you with, where are you usually using, what steps are you undertaking, those can really help define what people's triggers might be, on all sorts of those things involved. So that's really where you can do a proper risk assessment, and sometimes it's a matter of just changing the setting can make a huge difference, as Nick was making as saying as an example. Do you want to mention the Vietnam?
It's in your head. Go ahead.
Okay, so sorry about that. I was putting Nick on the spot. But there were a number of, I'll speak for myself, I'm a damn American. But there were a number of American soldiers who were using heroin during the Vietnam War, and a large portion of them, a huge percent, once they came back to the States, were just able to stop using, just because that's how the setting was so different that they didn't have the same desire to use. And so that's a classic example of how the setting can make a huge impact on your experience.
Diane's asking around, I mentioned that the cost of the drug can influence the risk, and could I elaborate on that? And for sure. I think when we're working with people that inject drugs, we get very caught up in terms of the immediate risks, in terms of physical risks to the body, in terms of things like overdose or infection. But when you're working within a harm reduction framework, we often think holistically about what's going on with people. And so that can include things like your housing situation, your social networks, your employment status. So when it comes to using drugs, the cost of the drug may be a factor to consider, because if you're spending a fortune on your drugs, you may now not have money at the end of the month to put food on the table or pay your rent. So it may be something you want to think about. Can I actually afford to use this drug? And maybe there's something else. If I want to use something, maybe there's a drug that costs something different. So that could be an example there.
One of the things that sometimes we recommend when we're working with our clients and they're doing their budgets is to actually be realistic about the cost of the drug and how much you're spending on the drug, and to actually put that in your budget. You can better make plans around the rest of your money and where it's going to.
Okay. We could talk all day about this concept, but I'm going to move us along. So hopefully that just gives you another tool in your toolbox to help have more holistic and in-depth conversations with people. So if you look at this picture here, do you think this is a good place to be injecting, or what might make it unsafe, but what might also make it safe? And here I want you to raise your hands, get on the phone, or type away in the box here. This is where we want you guys to do some thinking. What might make this context, this setting, an unsafe place to be injecting? Or equally, is there something that could make it a safe place for someone to be injecting? got a few people typing here. Diane suggesting that it's isolated and far from help if needed. Yeah. Same question there, and then additional comments around it doesn't look particularly sanitary. We have a link. We have a link later on that you can look at on your own time, which is a demo demonstrating all the different steps required for an injection, and you'll see it's done in an idealized setting where the person actually has a nice surface on which to use, and they're able to wash down the surface and then prepare all their drugs on that. And again, that's an ideal context in which it's happening. Here, it'd be a lot harder to follow some of those steps. Right? So while some people are suggesting it's an isolated area, others are saying that could be a positive thing, though, because you're away from the police. So there may be some advantages. People don't see you. But on the flip side, if you then have a problem, people aren't there to help out. Right. A couple of people mentioning the risks of injuries. I think particularly once you maybe become more intoxicated, it would be very easy to trip on that, even if you're sober. All sorts of things you can trip on and hit yourself or cut yourself on. Yeah.
I think Joel's point about there being other used equipment around is also important, so there might be danger of potential needle stick injury or something like that.
It would be a bad trip being there even without the drugs. And on the call on Tuesday, there was talk about where in the province this actually was, and could a bear come along and eat you? Yeah. So again, it may be very easy to look at this and automatically think, well, that is not a good place for someone to be injecting, but we also need to remember there are reasons, there may be very valid reasons for some people to think about this as a place to be using, and we always need to be keeping that in mind. Okay. Just FYI, that is a picture about maybe 300, 400 feet away from a needle exchange in Sudbury. And it's interesting, I found this place just walking around because people would very often go to the needle exchange there and then come right here as a place to inject. And again, that speaks to the fact that we don't have safe spaces for people to be using, so they've gone and created one for themselves. Okay, so let's think about some of the other risks and ways of reducing some risks for injection drug use. So these are some very basic things, but people that are injecting should really know about what they're using, how much to use, and the physical effects of those drugs. You can easily go on Google and start Googling away, but I would tend to discourage that because there's so much contradictory information out there on the internet. A highly recommended site is erowid.org. I don't know if anyone here has visited there. Perhaps you can just sort of maybe try that raise your hand function if you've ever gone to erowid.org. It's a great site. It's by drug users, for drug users. It's been vetted. So I see a few people have actually already visited it, so that's great. There are a number of different sections. Some of them are culturally based, some are arts-based, but the section, if you're looking for info on drugs, is the plants and drugs section. And on there you can find pretty much any pharmaceutical drug, any street-based drug, and you'll get information on the chemistry of the drug, the physical effects of the drug, and there's pictures of the drugs, there's user reports. So again, that's a really good resource, and I encourage you to do that. And I see some of you have already done that. If you raise your hand, you can just lower it again now. Thanks. So people, again, want to think about where you want to think about where you're injecting or who you're injecting with, and this is a big one in terms of not using alone. You really want to encourage people to be injecting with others that can then take care of you if you have a problem. Right? And you may want to think about, if you become intoxicated, how do you reduce the risk of being assaulted when you are intoxicated? So again, we encourage people to use with people you trust. Let other people know if you're leaving, where you're going, and who you're going with. These are things that people can be considering and thinking about. Safer injection practices can really reduce the chance of damaged veins, wounds, abscesses. That also include overdose there. So we will be looking at in more detail about some of the safer injection practices with the equipment. Equally, you need to know where and how to access new equipment, and don't be sharing equipment. So that's important to know where and how to access it. But as workers, we also need to be mindful that not everyone's going to be able to come to us. And as we were talking about earlier, it may be that we need to develop better outreach strategies and make equipment more accessible and easy for people. I think a great example of this wasn't actually about where to access equipment, but it was about where people were dropping off used equipment. I believe it was down in Guelph. I may be mistaken, but there was a concern that people were not returning their drug-using equipment. And what they were able to do was develop a partnership with one of the local coffee shops to have a biohazard container in the bathroom. And biohazard containers can be used by anyone. There's lots of people, diabetics out there, that need to dispose of their needles. So one of the things they did was partner with this coffee shop so that people could then just go and drop off their equipment there. That's a great example of a program making things just easier for people and thinking a bit outside of the box. Okay. Obviously, when you're then preparing for an injection, to wash your hands and prepare that injection site with an alcohol swab. We'll talk about that in a second. Some drugs you actually have to heat up to help them dissolve, so make sure if you're using any heat sources like candles, that those are extinguished when you're not using them, or that you've turned off the gas stove and it's not burning or releasing gas. So those are things to be thinking about. Okay. And now we're going to get into some of the specific equipment. Okay. So we'll talk about all of these different pieces of equipment. This is typically the various different pieces of equipment that people are going to be using when they're injecting drugs. And these are all products that are available through the OHRDP. And there's a link to their website and more detail about those products. And obviously then people also need needles and syringes if they're going to inject drugs. These don't come through OHRDP, but all of this other equipment does here. So we're going to talk about these in this order, and then we'll talk a bit about the needles as well. Just a brief note before we do that. If you're working at a site that is distributing this equipment and you have some of that stuff in storage, just make sure that the stuff at the back is being moved to the front. Some of it does have a shelf life and an expiry date, so it's important just to keep your stock up to date and you're using the stuff that needs to be used more immediately. Okay. So these are just some general best practice recommendations, is that you use sterile and pre-packaged equipment. And that's exactly what you're getting from OHRDP and then being handed out at the needle exchanges. Each piece of equipment is typically designed for single use only. And again, as we said, any of that stuff, if you're reusing any of it, you're really increasing your risk of HIV and particularly Hep C transmission. And you're introducing the chance of bacterial infections if you're storing any of that stuff for later on, particularly things like the cotton, which we'll get into. Okay, here's another poll before we do that, and let me just pull that up. Okay. So, of the products listed here, what product is not needed for everyone who injects? And just click the little buttons here. Again, it's anonymous, so we can't see how you are responding individually. If you have to guess, there is an I'm not sure button. So in terms of what product is not needed, we have sterile water, cotton filter, ascorbic acid or vitamin C, Vit C, cookers, or you're not sure. Okay, I think most people have voted, so let's see what people were saying. Okay. All right, so the majority of people were suggesting vitamin C might not be needed, and then some people, there's a range of people just picking some other choices here. The correct answer is vitamin C. Okay. We'll talk about this later, but there are some drugs that require an acid environment in which to dissolve and break down, but a lot of drugs just readily dissolve in water, so you may not need this. But all of these other pieces of equipment, typically you would need these for an injection, and again, we'd encourage you to be using each of those one time only. Okay. So alcohol swabs. So as we go, we have each piece of equipment, and then we have other terminology for it and a bit of a description around it and some of the best practices associated with that. So alcohol swabs, wipes, swipes, pads, or swabs. This is other terminology you may hear when people are coming in and asking for stuff. This is might be what some of the language they're using. And I've got a second poll here, and this poll here is specific to. Oops, sorry. Okay, so when it comes to your injection site, okay, how should you wipe an alcohol swab to clean an injection site? In a singular direction, in a circular motion, it doesn't matter, or you're not sure. So click those little buttons there. I'm just waiting to get a few more responses here. Okay. If you haven't voted yet, click your buttons because I'm ending this poll in about 5 seconds. All right. Let's see how you guys did. All right. So about half of you are suggesting in a singular direction. A few of you are suggesting a circular motion, and a couple of people aren't sure, say it doesn't really matter. So you can see there's a difference of knowledge and understanding already on the webinar here. And the correct answer, though, is in a singular direction. Okay. So can you show that on your arm, Cece? So Cece's just it's hard to get the directions right, but Cece's going to show you if someone was to choose to inject in their arm, before injecting you want to wipe the surface to remove any bacteria or dust, and you want to do that in that singular direction, right?
So if you're winding up working it in a circular direction, what you wind up doing is actually just moving the bacteria around the injection site. But it's often, sometimes our knowledge is outdated, and a circular motion, used to be the best practices a few years ago. So that's why we're doing this. Part of the reason why we're doing this webinar is to make sure that people know that it's actually recommended to wipe in a singular direction. That way you're just moving the dirt away from the injection site.
Okay. So again, really it's just to remove anything off the surface before you then break the skin. And again, as Cece mentioned, just one direction. One last note on that is you also might want to just let the alcohol dry before you then break the skin with a needle, because if you do that, the alcohol can irritate the injection site. You'll feel a bit of stinging. So we'd suggest that you just let that dry off before you actually inject. equally important then is once you have injected and you remove the needle from your arm or wherever else you're injecting, there can be a bit of bleeding. It's not recommended to use the alcohol swab to wipe away any of that blood because, again, the alcohol will irritate that open wound and it will sting, but it'll also make it harder for it to clot and heal properly. So if you do experience a bit of bleeding, just a tissue, dab a paper towel or a piece of clean cotton just to try and help stop that bleeding or clean that off. Right. This is one thing I learned when we were putting all this stuff together. Sometimes people will actually take a handful of alcohol swabs, maybe 5 of them, just stick them all together, rip the tops off, and light them, and that alcohol will actually burn for a while and can be a source of heat. So people will occasionally use them for that. Again, it's not necessarily an intended use from our point of view, but it's a reality of how people may be using or alternative uses for some of this stuff. Yeah, the other thing, people have been known to try and extract some of the alcohol out of those wipes, so Nadia is suggesting that they may extract those into water, drink it. I've even heard of people just literally sucking on the alcohol swabs. Right? Going to talk about cookers next. Nadia's just typing one last thing there. I'll let you guys read what she writes, though. So when you're preparing your drugs, typically you buy your drugs. They're either in a powdered format or a pill format, typically. And in order to inject those, you need to mix them up into a solution for injection. So people will often, what's known as cook their drugs, make them, prepare them in a cooker. Historically, people have used just regular spoons to do this, but these are 2 different types of cookers that OHRDP distributes. So other terminology for these might be spoons. Again, the historical connection there. The ones on the right here, and I'll show you another picture of these in a minute. When you flip these over, these are actually colored, and they're different colors. Sorry? Oh. Sorry, yes. CC was just pointing out, I was moving my screen cursor, and you can't see my screen cursor. So here, these ones here, these cookers, when you flip them over, are different colors, and they typically come in red, green, different colors. And they have been referred to as the Christmas cookers because of those coloring. But why we hand out different colored cookers is, again, if people are not using these single-use only, they at least I would have my green cooker and CC would have his red cooker, and we're less likely to be sharing those. So again, there are 2 different versions, and there are advantages and disadvantages to each of these, but it's more like it's really to do with your personal preference and practice with each of these. Right. The Steri cups here, so these ones are called spoons. These ones are the brand of Steri cup. These come pre-packaged with a built-in filter and a little pad for dabbing after if you're bleeding. So you'll notice here, this is the cooker itself. Here on the other side, you'll see this one is blue, and the little green plastic thing here actually gets inserted on here and acts as a handle, so that if you're heating this, you've got a protection from the heat source. Right. So again, cookers are used to mix the drugs up. You're going to be adding your drug to the cooker and then adding sterile water. And as I said earlier, you may or may not need an acidifier. So that's where you may add some vitamin C. Often people will heat that solution slightly, so they may just hold the cooker over an open flame or a candle to help dissolve the drug a bit. These cookers do not contain harmful products or chemicals, and again, they're much safer to be using than spoons out of the kitchen drawer, because you don't know how clean those are. So we encourage the use of these cookers. But again, if people are reusing these, or multiple people are sticking their needles in the same cooker, there's a real risk of Hep C transmission. let me know if there's anything in the chat. Okay. So in terms of how to use these, pretty simple. Remove that packaging. If you're using the SteriCup one, attach the handle if you need to. Place the cooker on a smooth, flat surface, and that might seem simple, but again, if you're out, if we looked at that picture earlier, when you're outside, you have a nice stable surface to prepare stuff on, because these things can tip over quite easily. You then add your drug, your water, and the acid if you need to, or the vitamin C if you need to, and then slowly heat it. There was this thing from the City of Ottawa Public Health a long time ago now, but they were suggesting that you heat the solution for a minimum of 15 seconds, as that may help kill some of the bacteria that may have been introduced into the solution. That's just a picture of attaching the handle to the SteriCup there. Again, it's a pretty short handle, and if you've got a flame source under here, this thing will heat up quite quickly, so we'd suggest attaching that handle. Obviously, you saw how short that handle was, so just be careful when you're heating that you're not getting your fingers too close to any flames. Right? Depending on what you're heating it up with, versus a stove versus a flame, you may need to hold it over there a little bit longer. Right? And again, depending on which cookie you want to use, that really comes down to practice and personal preference. So then the next thing we'd be looking at is sterile water. So this is pre-packaged. These are 3 milliliter ampules, and this is much safer to be using than tap water or puddle water. And if you think about, again, the context in which people are injecting, are they using this sterile water, or are they using other things? The obvious concerns with puddle water in terms of bacteria that could be in there, but even water coming out of the tap, while it might be safe to drink it, not always safe to be injecting. So better to use this sterile water. And again, these are 3 ml size ampules. So depending on what you're injecting and how much you need to break it down, you may require a smaller or larger amount of water. But these, it used to be that there were large ampules being distributed. The 3 ml size is enough that it should be good enough for an injection, but small enough to discourage sharing of those ampules if there was water left in them.
Nick, if I may?
Yep.
The cookers wouldn't be able to hold any more volume.
Oh, that's another reason.
Drug mix or water. So that 3 ml is the max.
Okay, great. Thanks. In terms, again, how to use these, they're just little plastic containers. You literally just break off the cap, turn it upside down, and then squeeze to get drips of water out. An important thing here, and this would be very important for people that have just spent a bunch of money on their drugs, is that you don't want to squeeze these things too hard and squirt the water out, because then you're just going to spray your drugs everywhere. So turn it upside down and let the water sort of drip out onto your drug. Okay. And then let that drug dissolve in the water. And then dispose of those ampules. You can typically just throw them in a container with all the injection equipment. Right? And we again discourage using any water that's been left in an ampule. You don't know how long it's been sitting there or what bacteria may have been introduced. Right? And here, again, you want to be dripping that water in and not squirting it out and throwing your drug everywhere. It would get some very upset people if they did that. So some people, in terms of trying to get the water out of those ampules, some people have reported actually just sticking a needle in through the plastic and then drawing it up into the needle. We would discourage you from I would discourage people from doing that because you can dull the needle. It can become barbed when you do that. So there's some tips there if people are going to insist on doing that in terms of things they might consider if they want to do that. And it's important to note, I think particularly at this time of year, if you're doing outreach, that the water can freeze in colder temperatures and it can break the ampule and then make it a non-sterile at that point. Okay. So if you've got your drugs in the cooker, you've added some water. If you're using drugs like brown heroin or crack cocaine, they may not dissolve well in water, so you need to make it an acidic environment, and this is where the vitamin C comes in handy. So other terms of vitamin C, Vit-C is citric. If people don't have access to this sterile powdered vitamin C, then they're going to use household or readily available forms of acids such as lemon juice or vinegar. So these will help break drugs down, but again, they're not sterile. They can introduce bacterial and fungal infections. So again, vitamin C is a lot better to use. It's also less damaging to the veins than vinegar or lemon juice. So we've gone through the process of adding the drug, adding the water, and now you're just going to add a pinch of the vitamin C. You're not emptying that whole packet into the cooker. You want to actually use the least amount of ascorbic acid as possible because it will create an acidic solution, and the more acidic it becomes, the more damage you can do to your veins. So it's really a matter of adding a pinch. I'm going to show you a link to a video in a second that describes this more. But if you've added your drug and some water and you've added a couple of pinches of vitamin C and you've heated it up, at that point, if there's anything that's not breaking down at that point, it's likely just filler from the pills or other contaminants in your drug. And adding more vitamin C isn't going to break it down. All it's going to do is create a more acidic solution, and that's going to hurt your veins more. So here is a video. We're not going to look at that, but for your own learning, you can click that link. It links to a video in the UK that and they've done a proper lab analysis of this in terms of how much ascorbic acid to use. Just one note, you'll notice the products that they're using may look slightly different in terms of their packaging than the ones you're familiar with, but it's still a good video to help people understand that they don't want to use too much of the vitamin C. So once you've got your solution ready, you need to get it up into your syringe, but there may be some undissolved particles in there, so you're going to add a filter before sticking your syringe on that, needle on that to draw the solution into the syringe. So these are, again, just filtering out any particulate that has not dissolved. People may also talk about cotton. They'll talk about filters or cotton. So some of you may be familiar with these little cotton balls that we used to hand out, and we had to pre-package them in these little baggies here. These are now being, the distribution of these is now being stopped, and we're using these, sorry, my computer's trying to update stuff. We're now have moved to these pre-packaged sterile filters. These are a lot better than these previous ones.
Nick, if I may just go back to that slide, the little cotton balls, as Nick mentioned, they were originally designed for dental packing, and they are their pore width is very large, so it didn't really protect anyone from particulates going into the syringe, whereas the little pellet ones have a denser pore width and do a better job of filtering.
Okay.
They aren't perfect yet, but they are so much better.
Okay, great. Thanks.
Nadia, OHRDP.
Again, you just
Has left the conference.
add a filter into the cooker, and then you're inserting the needle into the filter on top of it, and you're doing that bevel down. So there's a picture of an enlarged picture of a needle here. This is bevel up, but you would flip the needle around to put that on top of the filter, and then draw the solution into the syringe by pulling back on the plunger. There is a link here. Let me just pull up something else for you here. So here, if you, I think you should be able to click on the first thing here, OHRDP filter guide instruction, and you should be able to, I think if you click on it, download it. If someone is able to do that, please just chat in the window or let me know if you were able to do that. It's our first time trying this.
Has joined the conference.
This was a step-by-step guide that OHRDP developed in terms of how to properly use those filters. Oh, great. So it seems to have worked. Okay. I'm just going to move this box over here for now, just to let some other folks download that file if they need to. I'll hide it in a minute and then open it up again when we come to another file. So there's some really good pictures there and showing you how to actually use it. For example, you want to actually get the filter in the right way to use it properly. Okay. Just again, caution people to handle these as little as possible, because the more they get handled, the more chance you have to introduce viruses or bacteria. If people do not have access to these, they may be using cigarette filters, but these really are not safe. They can get little bits of fiberglass particles that can get into your solution, or may, if they've been smoked, contain other harmful substances. So we really discourage the use of cigarette filters. You don't need bits of fiberglass floating around your bloodstream. This is a very text-heavy slide, but there are a couple of quick points. Again, we don't want people all filtering through that same filter, because you're just introducing more bacteria and viruses. Some people will keep their filters because there is some solution left in them, and once you have a handful of these filters, you may then be able to rinse off any of that solution for one final hit. The concern there is if you're keeping your filters and they're lying around, you're introducing, again, fungus and bacteria that can grow in these things. So we really discourage the people doing this. You can be susceptible to what's known as cotton fever. It's a bacterial infection. Should clear up on its own, but if it's not, people really need to get medical attention for that. Okay. I'll pull it up again later. Okay. Thanks. So you've mixed your drugs, you've pulled it up into the syringe, and now it's time to actually inject. So some people will use a tourniquet to help get the veins ready. You'll hear of other terms such as ties, bands, tourneys, armbands, or cutoffs. And again, these are used if you've ever been to the doctor and had blood taken. They may have put one of the band on you just to help your veins pop a bit more. Again, the concern with these is there can be a bit of blood spatter on them and potential for transmission through these. That's just a picture of them. They're currently blue ones that we're distributing. Oh, here's another poll. Okay. So, at which point during intravenous injection should the tourniquet be removed? So again, this is anonymous. Click the box you think. Should the tourniquet may not be needed at all, or just before the drug is injected, right after the drug is injected, you have some other suggestion, or you're not sure? So just click these boxes here. I'll give folks a minute to respond. Think about that. Okay. The majority of people have responded, so I'm going to close that poll and see how you responded. Okay. So again, there isn't a consistent answer here. People are picking various options. Most people are suggesting just before the drug is injected. That would be correct, but it's also that a tourniquet may not be needed at all. Okay, so you only need to be using these if you really need to. And then if you are using your one, you want to release it, so you want to put the needle in maybe and then release the tourniquet. If you don't, and you try to inject that solution in while the tourniquet's still there, you're going to build up too much pressure within the vein. So really, these should be used by one person and not shared, and only if they are really needed. And particularly for people that are newer to injecting, haven't had as much damage to their veins, they should be able to inject without using one of these. Right? If people don't have access to these flexible rubber tourniquets, they may be using things like rubber ropes or belts, wire. The concern with these is they become a lot harder to release quickly. And they can cause more damage and trauma to the arm. In terms of when to replace, these are, if you are using this on your own and not sharing it, you don't necessarily have to use a new one every time you inject, but if there's any visible dirt or blood on it, if it's ever been used by someone else, or if it's just losing that elasticity, then you want to be getting a new one. There are other ways to help pop your veins, though. So if you're having trouble getting access to a vein and you don't have a tourniquet, then just clenching and re-clenching your fists, just going like that, can help pop up the veins. Applying a hot compress, windmilling. These are all different techniques to help get those veins to pop up. I don't know if I said this at the beginning of the webinar, but it's being recorded, but we'll also send you a PDF of the slides, so you'll get to reread these on your own time. Okay, so that was all the equipment that's being distributed through OHRDP. Again, at the end of this, we'll come back. If you have specific questions for Nadia OHRDP, we can come back and ask those. Just to talk about the needles, though. So this is a picture here of a needle and a syringe. So the syringe refers to this part, the barrel and the plunger, and then you have the needle itself and then a cap for the needle.
Has left the conference.
So here's another poll. So which of these needles is thicker, a 30 gauge, a 26 gauge, or are you not sure? Okay, I'm going to close that poll. Okay, most people are saying the 26 gauge is thicker. A couple of people thought maybe the 30 gauge would be thicker. The correct answer here is 26 gauge. So actually, the higher the number, the thinner the needle. So it may seem counterintuitive, but again, the higher the gauge, the thinner the needle. And this is important for people to be thinking about in terms of, well, what gauge needle do I want? And that's going to depend on what drug you're maybe injecting. Are you injecting intravenously into a vein or into a muscle? Where on the body you're injecting. So if you're injecting into a big, thick vein, you may be able to use a slightly thicker needle, but a very fine vein somewhere, you're going to need a thinner needle. Right? So that depends on the conditions of your veins. Again, accessibility to supply. So it may be that the needle exchange only has a limited number of options in terms of what you can access. Right? Typically, we would recommend, although this isn't true for everyone, we would typically recommend, though, choosing the shortest and thinnest needle. And again, this just looks at those differences. Typically, thinner needles are used for smaller veins or for newer injectors. But if you're injecting things that need to go into muscles, you're going to need probably a thicker gauge and also a slightly longer needle. Or if you're doing piercings, typically those are with thicker gauges. So that's just some more information there in terms of which ones to be using. Okay. And then the syringe itself, you may be able to access different size syringes. So we're not talking about the needle, but the actual syringe, and they can come in different volumes. We'll talk about shake and bake in a minute on group mixing of drugs, but you may sometimes have look to use a bigger volume syringe as well. In terms of disposing all of this equipment, it's really best just to check with your local jurisdiction around those policies. They do vary around the province. But again, we want to be encouraging clients to be dropping off stuff, making it as easy as possible for them. So maybe providing them with biohazard containers. They don't always have to be those big yellow ones, but you can sometimes access the smaller black individual ones, which are much more discreet. Or building partnerships with other social service agencies or health agencies to put needle disposal containers around the community. I'm assuming everyone's doing okay. I'm not seeing too many questions, but again, just a reminder, if you need to jump in, please do. Wanted just to talk about the advantages and disadvantages of putting kits together versus handing out all the individual pieces of equipment. So here's another poll. So best practice for needle exchange is to provide one new needle for each needle return. Is that true, false, or you're not sure? Yeah, we got about half the people have responded. Let's just give it a second. When it comes to needle exchange, is it best to hand out one new needle for each one returned? So 80% of you are saying that is false, and you guys would be right. Okay. When needle exchange first started, it makes sense sort of exchange. So I bring in a used one, and I'm going to get a new one. That might sort of intuitively make sense, but really what we often talk about instead of needle exchange, we often talk about needle distribution. You don't know, for some reason they may not have been able to bring in their old needles for whatever reason. It could be that people are picking up needles for someone else. So it may be that they are requiring lots of needles, or maybe they're distributing to other people. So best practice is give them what they're asking for, and not insisting that they bring in a new one before an old one before they get a new one. So here's another picture, and this is another place that I found one day, and you look at all this this is all unused equipment that's just been thrown out, and it's sitting there. So let's just have a bit of discussion around the advantages and disadvantages to handing out kits. On the one hand, we've handed out lots of stuff. People had access to all this equipment, but they didn't use that, and that's something that, at some level, a waste of resources. So I'm going to open it up for discussion here in the chat window. Please start typing away in the chat window in terms of the pros and cons of distributing prepackaged kits.
Had left the conference.
So Tim saying there's wasted product. There's definitely some examples of people just taking kits, taking exactly what they need for their fix in that moment, and just tossing the rest. Some of the pros encourages clients to use together, encourage encourages safe use, not scarcity. Some people are, that's a very clever thing, Shelley. Some people are making smaller kits
Beth from the
so that people are getting all of the
has
equipment,
left the conference.
but not more so. Client may want, sorry, I'm losing my place. Client may want to get in and out out of where they are. So yes, kits can be much more discreet in that way. Having
left
kits
the
on hand for
conference.
those who want them is a good idea, but also letting people just have what they want for sure. People who are novices, the equipment itself can hint to safe ways to eject. Might incite further discussion with a harm reduction worker. Joel, that's an excellent point, and one that will it's worth reiterating. Some people might not even know, like to think for the sterile water is a classic example, and they might stop and look at the kit and actually ask, why do I need this? And it might be a helpful tool for engaging in those conversations.
Han King.
Has left the conference.
Yeah, I think we often think of the equipment in terms of disease prevention and transmission, but these are also, I think, another extremely important. These are just tools for engagement too, and these are opportunities to start engaging people, having conversations. But we have to remember that every client is individual, and some people are going to be happy to sit down and chat and have a conversation, but others are literally coming in, getting what they need, and running off. So again, it's about having as many options available for everyone that's out there. Okay. Anything else there?
Yeah, and so sorry, really quickly, Chandra, and forgive me if I'm butchering your name. They might not be getting the appropriate needle, so it's important to think about when you are packing your kits. A lot of people use one needle, and as Nick was talking about earlier, people may need various size needles for different drugs, or if they're new to injecting, or if they're an experienced injector. So if you are making kits, maybe not making a one-size-fits-all kind of kit.
Okay. The other thing, many programs use these, putting these kits together as opportunities to engage some of the clients. So you may have peers or volunteers, because it can be labor intensive to put this stuff together. So rather than having staff do that, maybe there's opportunities to bring in volunteers or peers, and it gives them a sense of community, sense of purpose, way of connecting as a peer group. So that's another thing to be thinking about. So typically people are putting all the injection equipment that we just looked at into a kit, but there may be some other things we've heard about. Programs, depending on the budgets and resources, they have put other things in. So things like lighters. Sometimes you can get branded ones for your agencies, but these are safer than matches potentially, including bandages to cover up any cuts or abrasions, condoms and lube to prevent STIs. So these are all other things that you could consider, maybe a granola bar even. Those sorts of things can also be put together in these packages.
There was some interest in starting a conversation about the benefits and the pros and cons of whether or not to include vitamin C in the kits. Vitamin C might be a better example of something that's not needed for every injector, and whether or not you decide to put vitamin C in the kits or just make those available and ask people whether or not they need them. So some people are saying they have it available by request.
Okay. I'm noticing the time. It's just after 12 here. We have until 12:30. There are a couple quick things. I'm going to skip a couple of slides here that you can read on your own. Just want to show you a picture here and the importance of, we mentioned when you're drawing the solution into your syringe, that you want to have that bevel down, but when it comes to injecting, you want bevel up. So that's an important tip to give people. And this is why we encourage people to use one needle one time. You'll see at the tip of the needle here, slightly barbed, and after twice, even more barbed, and this is up to 6 times. That becomes a lot harder to now inject that, to insert that needle, and when you pull it out, it's barbing and catching on the skin. So that's why we just really encourage single use only for the needles. I mentioned shake and bake earlier. That's just rather than mixing your drug up in the cookie, you mix it up in the syringe itself. I'm just going to skip through these quickly because I just want to leave some time for questions at the end. Some people will lick the tip of the needle when they're prepare their drugs. They may squeeze it slightly to remove any air in the syringe and then may lick the tip of the needle just because there's a bit of solution. You're not actually going to get any real amount of drug doing that, but you are increasing the chance of introducing bacterial infection, so we discourage licking the tip. Okay. Some people will actually lick the injection site before as a way to clean that area, but again, much better to be using alcohol swabs than saliva to do that. I mentioned people removing air from the syringes, but it's not a significant concern. It's a bit of a myth. It may not hurt to do it, but it's not going to kill you. You would actually need at least 200 cc's of air to do any serious damage. Not being able to find a vein, particularly people have been checking for a long time, so there are other things to discuss with the clients. So maybe there's alternative routes of administration. Maybe they can choose to snort or smoke to give their veins a break. If they're really struggling and going into withdrawal and they've been using opiates, there could be things like Suboxone or Methadone. There may be some other tips, and I'll let you type anything into the chat window there, but I just want to move us on to make sure that you get the final resources before we wrap up. And again, please just raise your hand or type in the chat window if you have any other questions right now.
Has left the conference.
For Nadia. And as I wait for any questions to come in, I'll just move us through some other resources.
Has left the conference.
And just really quickly, I just want to point out this is a really great opportunity to really ask questions of Nadia from the OHRDP, who is joining us on these rounds of webinars. So I really encourage you to take advantage of her being on the call today.
I've just pulled up that box there again, so there's a couple files there. We already talked about the OHRDP one, but there's the IDU supplies handout. That's just a sort of fact sheet about what we've discussed today. And there's a link there in terms of where to find these exchange programs from around the province. Here's another resource available through OHRDP, and I apologize for not getting this file available for download, but you can contact OHRDP to get a copy of that. Here is a link to Katie and the best practices document. It's a huge, long document, which we tried to condense a lot of that into this webinar, but if you really want to explore it, and I encourage you to do that, and do some reading, that's where you can find the best practices document. I believe there's a webinar on that webpage too that talks a bit more about it. Here's a link to the safer injecting demo that is on the Katie website. Again, if you are going to look at that or show it to your clients, just think about the context in which they're using and how realistic it actually is that they follow all those steps. I do see some questions in the chat box. We'll come to those in a minute. Just to finish off, we will be sending you an evaluation for the webinar. That'll come by email later on, and we really do like your feedback to help us develop these further and what works better next time around. If you would like a certificate for participating in this webinar, please just email that address there with your first and last name and the session that you attended, and we'll email you one following. And if you need to contact either CC or myself, those are our web email and there's our website. So let's just go back to the chat box there and see what questions remained.
So there was a question about the process of using vitamin C for fentanyl and when it's actually added. Do you know, Nick?
I don't. I am not an expert in terms of opiate injection drug use. I can ask the expert on that would be Rafi Balin at South Riverdale, so perhaps we can clarify that with him. I wasn't aware that you needed vitamin C for a fentanyl injection, so I will clarify that with Rafi, and in our follow-up email, I should say, sorry, we will send the evaluation and the certificates in a couple of weeks because some of you will also be attending the Safer Inhalation and Crack webinars next week. So we'll send that stuff. Nadia's raising her hand there. Nadia, did you want to jump on the phone there?
Yeah, thank you. With the fentanyl, actually with almost any pharmaceutical opiate, there's nothing documented saying that you actually need the Vit C, so I think it is wise that we try to get some consistent information, Nick, on that.
Yeah.
So yeah, hang on, and there'll be more on this BAT channel coming to all of you.
So again, we'll follow up in a couple of weeks with a PDF of this, the recording of the webinar, the certificates, the evaluation, and any unanswered questions. Was there anything else on the chat there?
No.
Nope. Okay, if there's any final questions, ask away. Otherwise, if you want to log off, just hang up your phone and close your window, and that'll end the session. And appreciate everyone attending today, and we'll see some of you again next Tuesday or next Thursday for the inhalation webinars.
Oxford County Public Health.
Has left the conference.
Hawkesbury.
Has left the conference.
Grey Bruce Health Unit.
Has left the conference.
Kasha.
Has left the conference.
Jennifer Heyman, Waterloo Region Public Health.
Has left the conference.
AIDS Committee of Durham Region.
Has left the conference.
Tony, Jenny, and Emma.
Has left the conference.
Rebecca.
Has left the conference.